heart attack is the leading cause of death for both men and women. And although we have come a long way in treating heart attacks, it's still one of the most difficult clinical conditions to diagnose. This is why it's so important to recognize these early signs of a heart attack before it is too late. So in today's video, we will be learning about 7 early but often missed signs that could indicate you having a heart attack. No one. Jaw, neck, or upper back pain. When you think of a heart attack, chest pain is probably the first thing that comes to mind. However, many people don't experience typical chest pain when they're having a heart attack. In fact, some people may feel more pain in their jaw, neck, or upper back. This is because when you're having a heart attack, your cardiac muscle contracts with great force as it tries to compensate for the blood flow that has been blocked by a blood clot. This sudden forceful contraction puts a strain on your musculoskeletal system, which can result in referred pain to the jaw, neck, and upper back. The American Heart Association estimates that 1 out of 5 heart attacks present with jaw pain as the primary symptom, particularly in women. So if you've experienced any unusual jaw, neck, or upper back pain, especially when it occurs during physical exertion or emotional stress, it's important not to ignore it. Even though the pain may be mild at first, it can quickly become severe if left untreated. Moving on to 2. Excessive fatigue. If you've been feeling tired lately and you can't seem to shake it, it could be more than just a lack of sleep. Chronic fatigue is actually one of the most common warning signs of a heart attack, especially in women. One large study found that 70% of women who had a heart attack reported experiencing unusual fatigue in the weeks leading up to the event. But what causes this fatigue? Well, as you know, the heart is responsible for pumping blood throughout the body, which carries oxygen and nutrients to all of your cells. So when there's a blockage in the arteries of the heart, it can cause the heart to work harder than usual, which can lead to feelings of tiredness and exhaustion. Additionally, when your heart isn't getting enough blood and oxygen, it can cause you to feel weak and lightheaded, which can contribute to overall fatigue. Although fatigue alone isn't enough to diagnose a heart attack, it should definitely be taken seriously, especially if it's accompanied by other symptoms like shortness of breath, nausea, or chest pain. Next on our list is nausea and poor appetite. Do you often feel nauseous after eating? Or have you recently lost your appetite for no apparent reason? These seemingly innocent symptoms could be your body's way of signaling that something is wrong. When you experience nausea and vomiting after eating, it means that your stomach is having trouble digesting the food you've consumed, which can be caused by a variety of factors such as indigestion or an infection. But did you know that these symptoms can also be triggered by a heart attack? That's right. Research shows that nausea and poor appetite are 2 of the most common warning signs of a heart attack, especially in women. One study found that 44% of women who had a heart attack reported experiencing nausea in the days leading up to the event. So if you've noticed these symptoms occurring more frequently than usual, it's important not to ignore them. Even though nausea and vomiting aren't enough to diagnose a heart attack on their own, they should definitely be taken seriously, especially if they occur alongside other symptoms, such as shortness of breath, chest pain, or lightheadedness. Moving on to 4, lightheadedness or dizziness. Lightheadedness and dizziness are 2 other possible warning signs of a heart attack that often go unnoticed. When you experience a heart attack, your body's ability to pump blood and oxygen throughout the body is compromised, which can lead to feelings of lightheadedness and dizziness. Additionally, when you're having a heart attack, your blood pressure may drop suddenly, which can also contribute to these symptoms. Studies show that nearly 1/3 of heart attacks in women are associated with lightheadedness or dizziness. And even though these symptoms can sometimes be attributed to other less serious conditions, such as dehydration or low blood sugar, it's important not to dismiss them, especially if they occur alongside other symptoms such as chest pain, nausea, or difficulty breathing. If you ever experience these symptoms, it's important to lie down, relax, and seek medical attention right away. Next on our list is difficulty breathing. When you're having a heart attack, your heart's ability to pump blood and oxygen throughout the body is affected, which can cause you to feel short of breath, even if you haven't been doing anything strenuous. This is because when your heart isn't functioning properly, it can put a strain on your lungs. It's causing them to work harder than usual to try to get enough oxygen into your bloodstream. Additionally, when you're having a heart attack, the muscles in your heart can spasm, which can make it difficult for your lungs to expand fully, leading to feelings of shortness of breath. Research shows that shortness of breath is one of the most common symptoms of a heart attack, especially in women. In fact, one study found that 65% of women who had a heart attack reported experiencing shortness of breath in the days leading up to the event. So if you've noticed that you're struggling to catch your breath lately, it's important to take action. Even though shortness of breath alone isn't enough to diagnose a heart attack on its own, it should definitely be taken seriously, especially if it occurs alongside other symptoms such as chest pain, lightheadedness, or nausea. Next on our list is cold sweats. Sweating is your body's natural response to being hot or physically active. But did you know that sweating can also be a warning sign of a heart attack? That's right. When you're having a heart attack, your body goes into overdrive to try to compensate for the lack of blood flow to the heart. This can cause you to sweat more than usual, even if you're not in a hot environment or doing anything strenuous. But why does this happen? Well, when you sweat, your body releases fluid from your bloodstream, which can help to lower your blood pressure and reduce the workload on your heart. Your body sweats to try to cool itself down, which helps to reduce the strain on your cardiovascular system. Research shows that cold sweats are one of the most common warning signs of a heart attack, especially in men. One study found that 85% of men who had a heart attack reported experiencing cold sweats in the days leading up to the event. So if you've noticed that you've been sweating more than usual lately, it's important to take action. Even though sweating alone isn't enough to diagnose a heart attack on its own, it should definitely be taken seriously, especially if it occurs alongside other symptoms such as chest pain, nausea, or difficulty breathing. Finally, squeezing chest pressure. Last but certainly not least, we have chest pain, which is arguably the most well-known symptom of a heart attack. When you're having a heart attack, it's common to experience a feeling of pressure, squeezing, or fullness in your chest. This is caused by the blockage of blood flow to the heart muscle, which can lead to feelings of discomfort and pain. According to the American Heart Association, chest pain is one of the most common warning signs of a heart attack and can occur in both men and women. The pain typically feels like a heavy pressure or squeezing sensation in the center of your chest and may radiate to your left arm, lower jaw, or back. Even though chest pain is a hallmark symptom of a heart attack, it's important to note that not everyone experiences it in the same way. Some people may feel a mild discomfort, while others may experience a sharp stabbing pain. Others may feel a burning sensation in their chest. So if you've ever experienced any unusual chest pain, it's important not to ignore it, even if you don't think it's serious. Remember, it's always better to be safe than sorry. And that's it. Thank you so much for watching. Till next time.